Let's turn to research now. There are 5 chiropractic research chairs across Canada at the UQTR, University of Toronto, McMaster, University of Alberta, and UBC. The directors of these chairs are chiropractic PhDs. They're chiropractors and PhDs. Research tells us that the reason why patients consult a chiropractor is probably what you'd expect, mainly back problems and also head and neck problems. I'm going to focus for the sake of time on back pain studies and head and neck. I'm also going to touch on the serious complication of neck manipulation, which is stroke. So neck research. Quebec Task Force, anybody who's familiar with whiplash studies or neck injuries in general would be aware of the Quebec Task Force. Their conclusions: management of soft tissue injuries to the neck should be similar to management of back pain. Early return to function and activities rather than rest or immobilization in a collar, with joint manipulation and mobilization recommended to improve range of motion and reduce pain. This is now well-known knowledge that, except perhaps for the very initial parts following an injury, we don't want people to rest. We want to get them moving as soon as possible within their limits of comfort. And chiropractic helps to encourage this return to movement. The RAND Corporation, again an expert panel of different practitioners, concluded manipulation and mobilization were found appropriate for patients with many categories of neck pain and headache, where cervical signs of tenderness and limited range of motion were present. Let's now look at the risk of stroke. What exactly is the mechanism or the association of this complication to cervical manipulation? The risk is thought to be dissection of vertebral arteries with this impulse of an adjustment. So let's look at what the scientific literature tells us about the risk of stroke. First, as far as incidence. Published in Stroke, the evidence to date indicates that the risk associated with chiropractic manipulation of the neck is both small and inaccurately estimated. The estimated level of risk is smaller than that associated with many commonly used diagnostic tests or prescription drugs. Another study in the Annals of Internal Medicine: the apparent rarity of these accidental events has made it difficult to assess the risk. No serious complication has been noted in more than 73 controlled clinical trials or in any prospectively evaluated case series to date. How does this compare now with other therapies? This was published in Spine, comparing the serious complications of surgery, over-the-counter NSAIDs, and cervical manipulation per million patients. So we can see, you can just see the numbers here, comparing the cervical manipulation to the other therapies. Mortality rates. Again, we can look at the comparison of the numbers. The authors here concluded there are cases of serious injury following neck manipulation, but the risk is very small and remote compared with medical and surgical procedures given for the same health problems. World Health Organization. Authoritative reviews in recent years have addressed these questions and have all concluded that neck manipulation and mobilization are safe, effective, and appropriate for patients with various common forms of neck pain and headache. There is better evidence of effectiveness for manipulation than there is for common medical treatments for neck pain, including NSAIDs and other medication. These medications have much higher risk rates than manipulation. A more recent study done last year as part of the Bone and Joint Decade Movement. This was a 9-year prospective study following patients who visited chiropractors over that time and visited primary care physicians over that time. And the researchers basically tracked all of these patients over 9 years' time and determined how many strokes were happening in this patient population. This was a huge study. It ended up being 100 million person years involved in this study. Their conclusion: VBA stroke is a very rare event in the population. The increased risks of VBA stroke associated with chiropractic and primary care physician visits is likely due to patients with headache and neck pain from VBA dissection seeking care before their stroke. We found no evidence of excess risk of VBA stroke associated chiropractic care compared to primary care. In other words, what the authors concluded was if a patient consults a chiropractor with symptoms of neck and head pain, they may be in the process of having a stroke already. What's interesting is they found no statistical difference between visits to a primary care physician and to chiropractors over this 9-year period. I'm just going to touch on 2 low back research, again for the sake of time. The first is the Mead study, which is probably the largest study on chiropractic care ever conducted. This was a CBC interview done with the lead author, and he said, "Our trial showed that chiropractic is a very effective treatment, more effective than conventional hospital outpatient treatment for low back pain, particularly in patients who had back pain in the past and who got severe problems. So in other words, it is most effective in precisely the group of patients that you would like to be able to treat. One of the unexpected findings was that the treatment difference, the benefit of chiropractic over hospital treatment, actually persists for the whole of the 3-year period. It looks as though the treatment that the chiropractors give does something that results in a very long-term benefit," published in the British Medical Journal. And again, this idea of restoring proper function in the mechanics of joints shouldn't surprise anyone reading this study. In the Annals of Internal Medicine, if you want more information about chiropractic, actually, I encourage you to read this. It's a very broad article going through all the different aspects of chiropractic. And the authors basically looked at all the trials, all the randomized controlled trials on low back problems. 43 have been done for acute, subacute, and chronic low back pain. No trial to date has found manipulation to be statistically or clinically less effective than the comparison treatment. In other words, whenever chiropractic has been compared to another therapy, it's never lost. It's second. It's not. How can I say this? It's never been beat, basically, in the medical literature with the 43 randomized controlled trials.